All right, so the question that I wanted to talk about today that came in is what happens if I'm getting shin splints all the time, Doc? So this is really an important thing that I wanted to address. Shin splints are usually a result of gait, how you're walking or running. What I found is when patients are telling me that they have shin splints, it's a combination of two things revolving around that. Number one is how they're actually planting when they're running, how their gait is when they run. So what standard shoe gear promote is a heel to toe gait as you're running. And because of the way the midsole is, a midsole, just like there's an outsole and an insole on a tennis shoe, there's also the midsole. Midsoles, and like Nikes, they have air, Asics have gel. That's the midsole of the shoe. The way that there's a certain amount of foot drop that's incorporated into each of those shoes. In other words, the distance between the heel and the ground is slightly greater than the amount of distance between the forefoot and the ground. And so if you look at your shoe, a standard shoe, this is a shoe that I like, a Hoka shoe. You can see even with the Hoka, there's a little bit more of a distance between the heel and the ground and the forefoot in the ground. Now, what this promotes then is a heel to toe, and you end up with a forefoot slap many times as you're running if you are landing strictly on that heel. In order to see what then happens is you end up slamming that forefoot on the concrete or pavement, and that's the second component, is what surface you're running on. But concrete and pavement is very unforgiving, and so what ends up happening is that you slap that forefoot on the pavement or the concrete, and it sends shock and reverberations, ground reactive forces up into the calcaneus and then the tibia, and you end up getting inflammation across the front of your shin, hence shin splints. The biggest thing to remember as you're running is to, instead of hitting standard on the heel, you want to land more on the midfoot, and then you just have your regular toe off. By landing more on your midfoot here, you shorten the amount of distance between your gait, yes, but you also prevent that heel slap. So you make sure that you're landing on that midfoot, you will prevent the development of shin splints. And so that's my shin splint discussion today with you. If there's any questions, please post those at the bottom of this video. We'd love to have your input.